We're about to go live right now. All righty. Go ahead, Tiana.
Hello, hello, hello. Thank you everyone for joining us today. After a widely successful Women in Cannabis virtual cannabis conference, we decided to continue the conversation even further with all of the amazing women making the cannabis industry go round. So this is our first Canna Chat.
Yay! Weekly, every Sunday.
Happy dance, happy dance. And today we have the ladies of Tokes. We have Kym B, the founder. Welcome, Kym. And
Hi.
Hi. I kind of lost my screen, so I can't even see you, but I'm glad you ladies can see. And we have the co-founder.
Yeah.
Welcome.
Yeah, this is Kym B. I'm the co-founder and CMO of Tokes.
Awesome.
Welcome. We have the co-founder of Tokes, Ms. Deja Lee. And again, I love your name, but again, if I
you said it right. I'm so proud.
I love that name.
Like a year, for real.
And we're gonna have Dr. Patel joining us later on for Docs Patel CBD products, and she's amazing. She's actually just going through a family emergency with a COVID-19 family member that got diagnosed and is doing really bad. So all our prayers go out to her, and kudos to her for even wanting to join. Oh, there she goes right here. Let me get her in. Yay. Okay. I think. Hi, Dr. Patel. How are you? How are you?
Good. How are you?
Oh.
Good. We just was introducing you. I was saying that you're gonna join us later on in the conversation, but you're here right on top of the.
Yeah.
We thank you and we appreciate you, and God bless your family, and we're praying for you and your family.
Thank you. I appreciate it.
So, Dr. Patel, introduce yourself. I did briefly, but I wanted you to go into what you do and in the cannabis community.
Yeah, so I am a medical cannabis doctor, and I've been one since 2012. And over time, it's evolved from marijuana-based products to hemp-based products. So I went from practicing traditionally like a physician, where I was seeing patients one-on-one, to now becoming the CEO of a CBD products company, which is based out in the Chicagoland area in Illinois.
Awesome. And I want to introduce you to our co-guests as well.
Sure.
Kym and Dodge, right? Dodge. I said it for sure. Days from Tokes. They have an amazing CBD line as well. And we're going to get into our conversation. And we're just going to have casual girl talk about what's going on right now, and just try to make some sense around the whole cannabis industry in this time. Tiana, do you want to lead us off?
Yes. So I'm sure we're all aware of a lot of the recent news. Well, the news shifts all day, every day, especially in this climate, which is overwhelming. But, as lovers of cannabis and the flower and everything that embodies it, something that affects us directly is a lot of doctors and medical experts are now saying, given the fact that COVID-19 is a respiratory disease or disorder, that you should, people who smoke, whether it be marijuana, whether it be tobacco, whether it be whatever, thing can affect the lung, they're saying, stop it. Like, no, obviously some doctors are saying, try to decrease your usage, but I've heard some doctors say, stop. It's a bad idea. Just stop it. So we really wanted to have this conversation on alternate ways to consume the cannabis, and speaking to you, Dr. Patel, on obviously your opinion, what you think, what are you directing people to do, but the ladies of Tokes who have these amazing CBD products, the benefits of them, what's the deal? Help us.
Yeah, totally. So I think it's important to know how the COVID-19 virus works in order to figure out how to utilize the different methods of administration of hemp-based products and of marijuana-based products. So essentially, what's going on is that it causes what's known as a hyperinflammatory reaction. It puts for some people, not all, it puts your immune system into overdrive. So if you already have any baseline inflammation going, you're more at risk. Your body already has inflammation going on, and then to get this virus and to put it into hyperinflammation, it can lead oftentimes to organ failure. Okay, so inhaling any form of either of cannabis in general, right? We're talking about smoking, we're talking about vaping. So let's talk about smoking first. What smoking does is that when you're burning something and inhaling it, when you burn something, it creates pollutants. And those pollutants can potentially be inflammatory to the lung tissue. So I do agree on that opinion that if you do smoke any form of marijuana, you should stop while we're in this health crisis of the COVID epidemic or pandemic, actually, because you're creating a baseline inflammation in your body. Okay. When it comes to vaping, with vaping, you have to be very selective, very picky about what it is that you're vaping, because we have seen in the past where anything that, any sort of contaminant that gets into the vape oil could cause inflammation of the lungs, right? So in the past, we've seen vitamin E acetate, we've seen mineral oil even mixed in with vape oils that causes inflammation of the lungs. So with vaping, I would say be highly selective of what it is that you're vaping.
And when you say be highly selective, like what do you suggest? Because I have like a live resin, super clean vape pen. Is that good? Because I've been doing it. I've been smoking this whole time.
Yeah. So basically, what I mean by a good quality product is that it doesn't have any contaminants in it, right? You want to make sure it's made with carbon dioxide as opposed to anything else like butane, for instance. So it has to be a high quality vape oil that you're putting in your body. Okay. So you really need to do your research when it comes to what exactly it is that you're vaping, is what I would say. Yeah.
And that's the advantages to being over here on the West Coast, because you get to get a little bit more education as to what you're consuming when you go into dispensaries. But I feel like on the East Coast, we don't get that. We get a lot of bootleggers giving us vape pens, but we just don't get that. So we don't know what we're consuming.
Yeah.
So it's weird. It's a weird time. I feel like I just want to stop altogether and just stick with edibles. I might just stick with the Tribe Soap sub CBD edibles and just call it a day, or CBD drops. I don't know.
So I totally understand where people are coming from with this fear. I've had sensitive sinuses my entire life. I even had to have sinus surgery when I was younger, and I love flower, but I really, it irritates my sinuses a lot. And so that's actually why so Kym and I we like to call it a clean vaping company, but vaping has really helped me because it is a lot lower of a temperature. It's not combusting and releasing toxins in that way. And so I actually have here one of our Tribe Tokes pens this is our Saber flip battery, but we were, for Women Grow, we were on the runway for the first time ever, the New York City fashion show runway with vape pens.
I love that.
So Kym and our publicist blinged them out, which is amazing.
It was so
but
fun.
I've definitely moved to vaping if I want to smoke. But there are so many ways that you can get creative with CBD and THC if you're a medical patient, if you don't want to smoke. And we definitely put together, Kym and I, some ideas. But how do you want to, should we go through like product category? Like if you have a tincture at home, for example, there's so many things that you can do with it. And I think people don't even realize. But, Kym has she put up a YouTube the other day or on our IG Live about her daily immunity smoothie. And CBD is just another superfood that she has in this smoothie. We have our veggies and fruits and turmeric and other anti-inflammatories and CBD, and you just start mixing it into your daily routine. And Kym, do you want to add any other ideas in the kitchen possibly for the tinctures?
We need that recipe first and foremost.
Yes.
Definitely. Well, I'm the smoothie queen. I've been doing smoothies for over 10 years, and I've had my Vitamix for 10 years. And so I've been smoothie strong for a solid 10 years. And what I started doing is I didn't know what a tincture was 6 years ago. And so when I was using CBD and it was gummy, like a gummy, or, there wasn't even that many vapes out there. And I'm just not a fan of gummies all that much for health purposes. And so when I discovered a tincture, it was a game changer for me, because you can really use it in a lot of different ways. Of course, the sublingual, which the doctor was saying, so, rightfully, smoking isn't that good for you. With that being said, some people are just going to smoke. And that's just the way it is. I'm still smoking. What I have done is I've cut back a lot on smoking, and I also have implemented a no papers rule. So I like blunts. Actually, it's my vice. It's just my thing.
A nice blunt. You're a New Yorker. You can tell. You want a nice blunt.
Big fat blunt is actually how I like to live my life. But I've been using my water pipe. I have a dry herb. I have the Ghost, the dry herb vape. And then what I did was I did some other stuff in the kitchen. I got creative and I used a tea ball, which is you can fill this with tea. And I use a lot of loose leaf teas. This is one of the brands that I use. And this is loose tea. And I just grind up a little THC flower or CBD flower, and I mix it in about a bowl's worth. Now, this is not dosed. This is not dosed at all, but I just enjoy the way it makes me feel. And I started with about a bowl's worth, and that's what I like. And now what I actually do is do CBD and THC flower, and I steep it in the tea, and I enjoy it, and it makes me feel really, really good. So I have done that instead of I like to smoke the bowl. I have a glass grave pipe that I love, but I forego that in the afternoon. And I've been having this little bit of tea, and I love it. And it's really honestly, I sit at my laptop with my infused tea. And again, this is I don't know the dose or anything. This is just a home remedy.
A home remedy.
And but you could do it too with a tincture. You can really use a tincture and anything you want. Sublingual is the best, but you don't have to smoke. You can find alternate ways. And I use our vape pen a lot because I just for convenience. I have it next to my bed upstairs. So when I'm working in bed or reading in bed, I don't want to smoke. I don't want to go get tea. I don't want anything. It's just really convenient to puff on the vape a little bit. And then I've already brushed my teeth. I'm ready for bed. I don't want to smoke and then have to brush my teeth, and I have cotton mouth, whatever. So I really love the vapes at night. They're a really great tool to have next to your bedside. But I think the tinctures are really the new wave of consumption for THC and CBD, because it's just really easy to slip a couple drops under your tongue, hold it there for 60 seconds, and then boom, 3 to 10 minutes later, you can actually start getting the benefits of the plant into your body, and it's a different feeling. So it's really about you know, your own personal like routine. How do you put it all together? For me,
Right.
like I have a few different methods of consumption, and I love CBD smoothies are life to me. They're life. I love
Their
them
life.
every single day.
So
Now,
we have.
Dr. Patel. Oh yeah. I'm sorry.
Yeah.
Go ahead, Tiana.
Oh no, I was just getting excited about all of Kym's different methods, and I was going to ask more about the tincture because I do have some of you guys tincture. It's been featured everywhere from Forbes to High Times, so I know it's good stuff. We have the smoothies. I personally drop a couple drops in my tea, but where are we on cooking? Are there can we throw it in some food or cooking mixes? What are
Yeah,
the
you can. I tell people, like, if you don't have to cook it, don't. Like, you don't need to heat it up or anything like that. Like, you know, it's really, it's MCT oil, which you can use for, you know, it's fine for, you can like use it for anything, but like, you don't need to heat it up. I like to put it in my food as an aftermath, like to mix it in afterwards. And, that's really, I'm a vegetarian. I believe in, a very, you know, organic, raw plant-based diet, lots of raw foods, lots of veggies and things like that. So that's just coming from my perspective. But my sister uses our tincture in her salad dressing. She makes her salad dressing with it, and that's like her, in her mind, how she's integrated cannabis into her daily life, because she has a salad every night with dinner, and her dressing is infused with about 25 milligrams of CBD in her serving. And so like I think tinctures are really cool because they're like you can really use them in any type of way in your life. Like you could use it, like I know people that use our tincture as lube. I'm not saying that's what you're supposed to do because it's oil. Consult your doctor first. As a doctor.
You can put it on your skin. It's just MCT oil and CBD, full spectrum distillate. And so, you know, it's like if you have pain somewhere and you don't have a pain cream or you can't afford to buy both products, you can absolutely use it for that. But
I would just interject really quick and say that if you are going to use a tincture, you know, in the vagina, you want to make sure it's been tested for fungus, because you don't want to end up getting, you know, any sort of infections from it. So that's important.
Yeah,
very
definitely. I don't think that's what it's for. I'm just saying people get creative.
Yeah.
That's a very good tip though. And for the consumers out there, you can look on the microbial section of your lab tests when you're checking, because you should only buy products that you have access to lab testing, third-party lab testing too.
Yeah, and it's important to know when it comes to fungus, the cannabis plant is very prone to growing fungus, especially when it's grown in humid environments. It's especially prone to growing a specific fungus known as aspergillus, which if you're immunocompromised in any way, can be devastating to the body. It can end up in the lungs and cause what's known as an aspergilloma. So that's important to know as well.
So in conclusion, use the tincture for just oral consumption, okay? And if you got some lube, then use that for that. Don't mix them. Just want to be on the safe side. Dr. Patel, I had a question for you from Brenda on Facebook. She said, what should we look for when looking for high quality CBD? I'm totally lost on that one.
Yeah, so 5 things. Okay. And actually 6. So first and foremost, make sure it's lab tested. Okay. It's not a regulated industry. The quality of CBD products varies highly. Okay. And nobody's overlooking this industry. So do companies take shortcuts? Absolutely. Okay. So first and foremost, on the laboratory test results, you want to make sure it actually has CBD in it. Okay. So there are products out there that have little to no CBD. And at Doc Patel's, I'm personally vetting our CBD products. And so one of the things that I make sure of is that the CBD amount, the milligrams of CBD, is within plus or minus 20% of what's stated on the label. And there's a reason for this. Okay, so when you go to a pharmacy and you get a generic versus a brand medication, the accepted norm in terms of milligrams is plus or minus 20%. So I'm looking at it from a very medical standpoint. You want to look at the amount of THC, okay? By law, hemp-based products should have less than 0.3% THC. At Doc Patel's, our products have 0.00% THC. Okay, and we do that because we find that a lot of consumers are, even if it's a CBD product, they're still worried about getting high off of the CBD product. And actually, believe it or not, you can get high off of the CBD product. Here's how. People are just looking at THC as a percentage, but what you need to look at is the total amount of THC in the product. And how much THC are you getting in whatever amount that you're taking? Okay, so typically psychoactive effect of THC kicks in at around 10 to 15 milligrams. So you want to look at that as well. Okay. Third thing is that, like we mentioned, you want to make sure it's been tested for microbial contaminants, right? So specifically, our products are tested for E. coli, salmonella, fungus like aspergillus, like I mentioned. And like I said, that, it's immunocompromised patients that are very prone to getting sick from these microbial contaminants. Fourth thing is pesticides. Okay. And if the products are tested at a state licensed laboratory, they usually test for a standard set of pesticides. Okay. The other thing is heavy metals. Okay. So why is this important? Well, the cannabis plant in general is known as a bioaccumulator. Okay, so it soaks up all the heavy metals in its environment. And so those heavy metals can seep into the end CBD product that's made. Okay, and these heavy metals include things like arsenic, cadmium, lead, and mercury, which in toxic levels can be very harmful to the human body. And then the last thing is that make sure that the CBD products are made with safe and non-toxic solvents like either carbon dioxide or alcohol, otherwise known as ethanol. So those are all the things that I would look for. Right off the bat, if the product is not laboratory tested, don't buy it. Okay. And if the company's not willing to provide you with thorough laboratory test results, then move on to the next, is what I would say.
Nice. Oh, wow. I never even knew to look for all of those things. So I'm glad you said it. And I actually put it on our Facebook chat room here so that people can know.
And, if folks want more detailed information about this, I do dive into it in detail in my book. It's called the CBD Oil Solution, and you can get that off of Amazon.
Awesome. Do you have it on your website too? Because I'm going to share the link.
For the book? Yeah. It should, if you just go to our shop, there should be a link to the book that's available.
Perfect. I just put that up there. And so just so everybody can know, I don't know how versed you guys are in the CBD world. CBD is legal. You can buy it online. So it's not something where you have to come to the cannabis legalized states to buy. So you can go there and buy it. I listed both Dr. Patel as well as Tribe Tokes websites on there. You can go in there and shop and play around. Tiana, what kind of products did these lovely ladies send you yesterday?
Well, I have the full spectrum of the pen that Kym is talking about, which is, again, my anxiety levels are high. So I might have been consuming too much CBD, to be honest with you. I don't do dosage at all. It's something I'm working on. But the lovely pen, the CBD, this is the CBD disposable full spectrum pen. The tincture, which I've always added to tea, but now, Kym, we need that immunity smoothie recipe because I think I'm gonna add that to my morning ritual. A beauty mask. Tell me about the mask. This is the superfood beauty mask. It has kale, CBD, spinach, green tea, jojoba, white clay. What are the benefits of the mask?
The mask is amazing. So for the CBD, it's anti-inflammatory. So it's amazing for acne, redness, any kind of like skin irritation you have. But the other ingredients in that mask are phenomenal. Everyone knows that kale and spinach are good for you, but they don't realize that they're also good for your skin. And that's because they're packed with nutrients. And the mask, you leave it on for 10 to 15 minutes. It's bright green, so it's actually really fun to take like selfies. Used to be with your friends, but yeah, there you go. And when you take it off, it has this like little tingle and you can almost like feel it working. And then when you take it off, you know, it's just really brightening. You feel glowy, your skin's really soft. And this has been a lifesaver, having my like at-home spa routine, because we can't go for facials anymore. And I mean, everything's at home. We're all like trying to figure out how to do manicures, and but I like to do starting out with like a peel or some sort of exfoliator, because it helps all the other skincare products penetrate better into your skin. And then I do the superfood mask. And then I use one of our serums. We have a CBD collagen boosting serum and the CBD vitamin C ferulic acid serum. And then we also have our signature CBD eye cream, and then a lotion. And it's like you just left the spa for the day.
Oh, wow.
So I'm happy you got those already. Enjoy them and let us know what you think.
We'll list out. I'll list out after I do my self-care Sunday routine tonight. We'll list out on the Facebook page later the products and the links to go purchase.
Yeah, and we have one deal. It ends up being like a really good deal. We have a beauty bundle on the website where you can get all the products and you get a big discount for the bundle. But then you can use your 20% off your first purchase on the bundle. And you end up getting it for like a really nice price. So yeah, definitely check it out.
And I definitely can. Ladies are shipping fast too, which is right.
Yeah, we do everything today. You know, we charge a little bit for shipping on the website, but that's because we don't go cheapo on the shipping. Like we're like Amazon, like things just get to you, you know, and they're fast.
I got this in 2 days.
Yeah.
Oh my God, that's so good to hear.
Dr. Patel, I have another question for you. The questions keep coming in. I love it. Keep them coming, guys. Benjamin says, what does it mean to consume too much CBD? How do you measure your intake, and what's the appropriate level of intake?
Yeah, this is an excellent question. Okay, so the misconception out there is that there's no such thing as too much CBD. But in fact, there is, right? So you can, in fact, consume too much CBD. And here's what happens. Okay. So most commonly, typically what happens is that a lot of people will wake up feeling groggy or tired after taking CBD at nighttime. Sort of that hungover feeling that people get. Like, for instance, when you take Benadryl, for instance. And then less commonly, people can experience diarrhea. And even more or less commonly than that, people can experience changes in weight and appetite. Okay, so there is such a thing as too much. And so I'm going to give you some basic guidelines when it comes to using CBD products to figure out what dose is right for you.
I actually need to write that down.
because dosing does vary highly from person to person, right? Just let me give you an example. I had 2 patients with insomnia. These were women who were otherwise healthy. The only thing they struggled with was insomnia. And they were on no other medications or anything like that. And they were both having trouble falling asleep. So I recommended the same CBD product to both of them. One patient ended up using 0.5 milligrams of CBD to fall asleep. And then the other patient ended up using 50 milligrams to fall asleep. Okay. Wow. So, and they were of similar body shape and size too. So that's another misconception that, dosing is based on body weight. It is not, because the CBD gets stored in the fat cells in the body. Okay. So as we all know, some of us tend to hold on to fat more tightly than we want, and then others tend to get rid of it quickly. So that's one factor that comes into play, how you store CBD in your fat cells. The other thing is, what's the machinery like in your liver that breaks down chemicals? And that can vary based on our genetics. Some people break down medications quicker. Some people break down medications faster. So basically what you want to do is, first and foremost, look at what strength of product you're using. There's a wide variety of strengths of CBD products on the market. They can range anywhere from typically about 250 milligrams in an ounce up to, even now you'll see about 2,000 to 3,000 milligrams in an ounce of CBD. Okay, I'm talking about tinctures, but it can also apply to edibles, for instance. So that's the first thing. What strength of CBD product do you need? Second is that what's the most appropriate administration method for you? Okay, and a lot of factors go into play here. So let me just walk you through an example. Someone who's had a gastric bypass surgery, for instance, they're not going to absorb edibles as well. Okay, so they're going to be better off using sublinguals like tinctures, for instance, or even vaping CBD products. Okay, then let's talk about the medical condition itself. Okay, so let's talk about sleep. So when it comes to sleep, not everybody's sleep struggles are the same. Some people struggle with falling asleep. Other people struggle with staying asleep. And then others struggle with waking up in the middle of the night and then not being able to fall back asleep. And there's different administration methods that work better than others for each of these issues sleeping, right? So for falling asleep, you can use inhalation. It's quick acting. It takes, seconds to minutes to take effect. But you can also use tinctures, and you can also use edibles. It depends on how patient you are in terms of waiting for the product to take effect. Edibles can take up to 2 hours to take effect. Tinctures, so drops that you put under the tongue, can take up to 2 hours to take effect. Okay. When it comes to waking up in the middle of the night and then, you want to fall back asleep pretty quickly, you don't want to wait around for something to work. So in that case, inhalation is your best option, vaping. And then staying asleep. So some people will fall asleep easily, but then they won't stay asleep through the night. In this case, edibles are your best option. Okay. And this is because they take longer to take effect, about up to 2 hours, but they last the longest in your system. So you'll get your 7 to 8 hours of sleep, and you'll wake up feeling well rested. So that's another thing, method of administration. Then next is dose. So this is important. You always, at the very minimal level, you want to mark down the date that you're taking the CBD product. Of course, make a note of the strength, like I mentioned before, but also the amount. Okay, how many milligrams of CBD are you taking? The goal is, people believe the goal is maximal, but that's not the goal. The goal is optimal. Okay, you don't want to take too little, you don't want to take too much, right? Just like Goldilocks. And you want to hit the sweet spot. And when you hit the sweet spot, what's incredible is that you'll continue to experience the medical benefits of it without the side effects, right? So a lot of times what happens is that people experience the extremes when they take CBD products. It's not working. I tried it. It's not working, or they'll say that I woke up feeling, like I mentioned, those side effects. I woke up feeling really groggy, like that's not the feeling that I want. So the goal is to hit that sweet spot. And the way to do that is be very methodical. Know what you're putting in your body and how much of it. So that's the other thing. Now, there's a lot of different ways to measure how much you're taking. With edibles, it's pretty simple, because say it's a chocolate bar, for instance, then you'll know about how much CBD is in that little small segment of that bigger chocolate bar. If it's a gummy, you'll know approximately how much is in that gummy. Okay. Now this is given that when they made the product, that the CBD is evenly distributed amongst all the gummies and and the entire chocolate bar. When it comes to inhaling, though, you'll never know how much you're taking, right? Because at this point in time, we don't have what's known as meter dose inhalers like we do with prescription medications, where you know how much, like for instance, with asthma patients, when they take a meter dose inhaler, they know how much medication is going in. Okay. That's not the case, unfortunately, with CBD products. And so with inhalation, you're not going to really know. And really what you need to then go by is the potency of the vape oil, right? You can find varying strengths, percentages of vape oil percentages on the market. So that's what you want to base it on then. I know that was a long-winded answer to the question.
Oh, it was good.
But
Does that answer the question that I believe Benjamin
was
had?
talking. I'm so sorry. I had it on mute. Oh my God. I was saying, no, it was great, because I'm getting so much response on our Facebook page saying that it was a great, like, you broke it down, and a lot of people didn't understand it. So we needed that.
Yeah.
Definitely.
One last thing I do want to mention is how frequently you're using CBD products. Okay. More often than not, people use CBD products too frequently, and then they develop a tolerance to it. So a lot of times, like for instance, I've had patients with back pain come in, severe back pain, and like they've spun their wheels and spun their wheels, tried like prescription medications, they've tried alternative treatments, nothing's worked. And then they'll use like high CBD products and they'll work, but then they'll get a little overzealous and start overdoing it. And then I'll get a call saying like, hey doc, it worked great for 2 weeks, but then it stopped working. Yeah, it's not working because you've developed a tolerance to it, right? You can't give the body too much because the body gets lazy, and you do produce your own what are known as endocannabinoids. These chemicals are very similar to like THC and CBD, for instance, and it stops producing those chemicals, and you don't want that. So I typically tell patients you don't want to take CBD products. So I don't recommend multiple frequencies through the day. Okay. I recommend just a one-time dose in a day. And this is based on science and based on what's known as the half-life of these cannabinoid products. And, you know, I've treated thousands of patients and this works for them. They don't have to, you know, go through multiple frequencies, you know, multiple dosings through the day. One-time dosing is sufficient.
But is that for something? I'm sorry to interrupt, but if that is that for someone with pain or someone with like anxiety that has multiple anxiety attacks throughout the day? For me, I'm like, I get super anxious and I just need to get some CBD drops or something. And then an hour, 2 hours later, something else can happen. And it's like, okay, I need it again. So what do you tell those people that feel like they actually need it throughout the day?
It's a dosing issue. You're not, that one-time dosing that you're taking, it's not high enough. And I've had patients who've had that come across that problem. And so once a day dosing, if you're taking high enough of a dose, then there should be, so I usually for, you know, when it comes to insomnia, anxiety, I usually have patients take the CBD product at nighttime. If you're taking the right dose, that's high, you know, the optimal dose, then you should have a residual effect into the next day. Where you're still feeling calm, you're still feeling relaxed, and you don't need to, if you're taking multiple doses throughout the day, then that dose that you're taking is typically not sufficient, is what I would say. Okay. So regardless of condition, this is just based on basic science, like how long does it take for the chemical to leave your system? And for cannabinoids in general, like THC and CBD, it's up to 30 hours. So it's there for at least 24 hours. Okay.
I didn't know it was all of this behind it. I'll just I'll just be like, all right,
Dr.
what I gotta do.
Let me ask you just for clarity, because I IMD. We're that same person where it's like, you know, many anxiety attacks during the day, tinctures, this, that. But I know you said after your body builds up immunity, you're not affected by a certain dosage anymore. So even if you start taking, okay, I set a plan, this is my dosage daily, you know, I have my one time that I take it, in 2-3 weeks, is my body still going to become immune? Am I going to have to continuously up that dosage?
No. So the patients that I've treated have stayed on, and I've treated these patients for years. So once we get it to the right once a day dose, they stay on that dose for years. We're talking about like 3 to 4 years. And they consistently are they typically use the same product because once it works, especially for things like chronic pain, anxiety, insomnia, you don't want to switch around products because you don't want to experience those things, right? Once you get something to work and it solves that problem, you want that problem to stay solved. So yeah, if you're taking an optimal dose, you're not going to develop tolerance to it.
Wow.
Yeah.
Oh my God, I'm learning so much right now. Thanks, ladies. Thank you so much. I did not get to check with that.
At a time right now, I kind of want to just close close today, which is at a time right now during COVID-19 where anxiety is again. Are you recommending extra doses? Are you just, is it therapy on? What are each of you ladies' recommendations during this time, you know, in terms of alternate ways to consume the flower?
I think stay hydrated and make sure that you incorporate time for your some type of fitness and stretching and things like that, and move your body in ways that will balance you out. If you're hunched over a lot, you know, really opening and lengthening. I've been a Pilates instructor for over 20 years, and Lululemon ambassador. So, just making sure that you're eating properly and using care in your own self inside and out, taking extra time. Like my girlfriend was like, my children are driving me crazy. And she's like, I'm just locking myself in the bathroom and calling my friend. I was like, they call that self-care, my sis. But so, taking some time to, acknowledge that you might need a moment to just really focus on yourself and things like that. So, proper nutrition and using supplements. I'm a big fan of Mary Ruth's Organics, which is pro and prebiotics and enzymes and multivitamins, things that I've been using well before coronavirus, but really just looking at, your health and wellness and saying, is this the best that I can do? How can I do better? And using cannabis and CBD, as the doctor stated, and in your dosing and finding your doses and using that, the plant-based medicine and alternatives to really, help focus and find your best self during your quarantine and chill time. But it's not chill for me. I actually work more now
right?
I did before, which I was like, how is this
So
even
true.
possible? But the other day, it was 12 hours straight, and I was like, I need to stop actually and like walk away from this. So yeah.
That's self-care too, honey.
True.
That's self-care too. Just stop and just walk away.
So I would say if you have flower at home that you've already purchased and you don't want to smoke it to protect your respiratory health, there are 2 women-run cannabis businesses that make machines that you can decarb your flower like into oils for baking. One is Levo and one is Ardent. Levo's out of New York, Ardent, Chanel up in Boston. You may have heard of them.
Yeah.
You can buy their products online. If cooking isn't your thing or that seems like a lot of work, there's a girl on our team who has a THC tincture from the New York dispensary. She made pancakes and put, it's a coconut oil based tincture, sprinkled it on top of the pancakes underneath the syrup, had infused pancakes for breakfast, ordered a pizza, sprinkled the tincture on top of the pizza. No cooking necessary. So there's lots of ways to be creative for sure. And even if you might want to smoke, like we were talking about earlier, like it might just be a short period of time right now where it might be the wise decision not to do that, or just to cut back a little bit or be a little bit more creative.
And have fun with it.
Yeah, totally.
Yes.
And you can still consume, it doesn't, you just have to think about it a little bit more creatively.
Agreed. Dr. Patel?
I'm finding that people are getting to the point where like the yoga and meditation just aren't cutting it for them. And they're like, I just need something that
going crazy.
Yes. Yeah. Like the ruminating thoughts, the anxiety levels where, people don't like their livelihoods are at stake right now. They're worried about the health of their loved ones. There's some like real issues going on right now. And so for even someone who doesn't have a history of anxiety, they may be experiencing situational anxiety right now. And here's the thing with anxiety, there's no over-the-counter option. And the only option that you really have are prescription medications. And CBD is a great go-to because unlike prescription medications, which once you start, you do have to take them on a regular basis, CBD you can use on an as-needed basis, okay? You're not gonna go through any withdrawal symptoms if you stop taking CBD products cold turkey. So that's what I'm recommending to my audience on social media that's coming to me with a lot of the anxiety that they're experiencing right now is, could I use CBD products? And I say, absolutely. So So that's a good go-to. Same with insomnia. People are having trouble sleeping. CBD products are a great go-to for that as well, right? Like I mentioned some of the over-the-counter options before, like Benadryl and melatonin. A lot of people don't have good experiences with these medications. And then over-the-counter options are like even worse. Like you have Ambien that, one of its side effects is that it causes sleepwalking. And so, yeah, CBD products are great for the issues that people are dealing with right now in the midst of this crisis that we're in.
Yeah. Wow.
Couldn't have said it better.
Wow.
Thank you, ladies, for your time, your insight, your advice. I don't have any last minute. I couldn't say it better. So Dee, I think
Yes. No, seriously, thank you, ladies. And I can't wait. I'm gonna go get you guys box. I want that 20% off too. I'm gonna get. Do I have to have a code? Do you have to email me a code or something?
Tribe 20. It's really
okay.
easy.
Tribe 20.
Tribe 20.
I'm gonna do a whole beauty spot probably next weekend, and just get myself together because my anxiety is at an all-time high.
Yeah.
And Dr. Patel, I'm definitely going to go on your website and purchase your book because I need to learn more about this. I love learning about new things, and the way you broke it down, it's definitely it definitely meant a lot. So we appreciate your advice on that.
Of course.
Thank you so much, ladies. And I
Yeah.
also, for the viewers, I put all their information into the chat box. You guys can go click shop and happy CBDing.
CBD and happy.
Did I just make that up?
Everyone. So we're
Yes.
420 Eve. So happy 420 tomorrow.
Before 20.
Thanks, ladies.
Yeah.
Have a good one,
All right.
ladies.
Bye.
Bye.
Bye.